All right, good afternoon, everyone. My name is Jeff Cooper, Montgomery County Health Commissioner. Thank you for being here on relatively short notice, but we want to make sure that we give you credible, accurate, and timely information regarding the coronavirus 2019 disease that we now know as COVID-19. As you are aware, the information is changing so rapidly that sometimes it's difficult to stay up to date. We're all at the point now where it's becoming virtually impossible to transition from engagement to meeting to staying abreast of all the information. And so this is a great opportunity to bring everyone together to where we all hear the same message at the same time. So we have several speakers today. I will be providing a quick overview, situation report, and kind of some reinforcing what we've all heard recently from the governor. Then we also have the Executive Director, Ron Nankervis from Winter Guard International, who will be making some comments, Jacqueline Powell from the Dayton Convention and Visitors Bureau, and then we certainly would like to offer an opportunity for Mayor Nan Whaley and Commissioner Judy to offer some comments as well. Additionally, our Medical Director, Dr. Michael Doane, is here to answer specific questions that you may have of a clinical nature. Okay. So as we are all aware, this novel coronavirus was first reported out of China on December 31st, 2019. It continues to circulate internationally, and it's virtually impossible to keep up to date on the number of cases that continually get reported. As of today, the World Health Organization has officially confirmed that COVID-19 is a pandemic. So it is spreading internationally, affecting all countries essentially, oftentimes at the same time. Globally, over 121,000 cases have been reported, over 4,300 deaths. In our country, and these numbers continue to escalate, 931 cases, 29 deaths across 38 states. We leave here today, we go home tonight, those numbers are going to change. I think we all understand that. At this time, 4 cases have been reported in Ohio. That number will increase in the coming days. There are currently no cases, confirmed cases, in Montgomery County. That number clearly will change in the coming days. So, previously, on March 9th, the governor declared a state of emergency. We have transitioned now from spread among close contacts to now community spread. And so the actions we need to take as a community, a state, and a country are very different than when we were responding to this a month ago, several weeks ago. So just to put this in context, our health department is charged with controlling the spread of disease in our community, and that includes COVID-19. We do that through a response structure that we have been using for almost 20 years. It's called the Incident Command System structure. We use that structure, our hospital partners use that structure, our public safety forces use that structure, and we're all planning, training, and exercising together to make sure that we can respond to whatever type of emergency may occur. So whether that is a natural disaster, such as the tornadoes that we're all familiar with, whether that's an act of bioterrorism that we experienced in 2001 with the anthrax attacks, or whether it's an emerging infectious disease such as COVID-19. So, our initial actions as a health department and as a community of partners has really been on focusing on surveillance work to track cases, monitor travelers, and identify potential individuals who may either be infected or potentially exposed to someone who has the infection. So we've spent the first part of this, quote, pandemic now doing those type of activities, along with assuring that we're giving accurate, timely, and credible information to all community partners, as well as the general public. All this information is updated on a daily basis on our website. Well, now we move into what's called the mitigation phase of a pandemic, because clearly those initial actions aren't enough. We've gone from close contact spread to community spread. And so, therefore, the tools that we use need to be ramped up, and they need to be different tools. So what are we talking about in terms of these different tools? And why are we going to do them? We're going to implement additional measures, and the governors and Director Acton from the Ohio Department of Health are trying to convey this in their news conferences. We're doing this to slow the spread of infection, to reduce the peak number of total cases over time, and to reduce the burden on our hospital systems as well as our community infrastructure. So it's really important we move forward together as a community, make really difficult, tough decisions in the best interests of our population to make sure that we control the spread of this disease. So those measures include really engaging in getting information to citizens about family home preparedness and planning. That's really important. Environmental surface cleaning, whether that's at home, in the workplace, in community settings. And then obviously what's on everyone's mind, social distancing measures in the workplace, at universities, and in public settings. And so as we move forward as a community, we will be adhering to and recommending the same thing that we're hearing from the governor regarding recommendations and or orders on mass gatherings. So what does this mean to the average citizen? What's the take-home message? So for citizens, let's focus on prevention. Number one, stay focused. It's really difficult to do. There's a lot of information out there. The potential for high anxiety. But stay focused. What's that mean? Identify what's important to you in your life and focus on it. Your faith, your family, your job, your community. Because it's too easy to become overwhelmed by all of this information. Stay informed. There's a lot of misinformation out there. We're all aware of it. We see it every single day. A lot of it is absurd. So stay informed. That means visit credible sources of information. The credible source of information in this community starts with Public Health Dayton and Montgomery County and our website. We are updating the information on COVID-19 on a daily basis. We're tracking what's on the World Health Organization site, the Centers for Disease Control and Prevention site, and the Ohio Department of Health. And so all community partners should be linking to our site and having that same information. Take everyday actions as a citizen to stay healthy. It's a prevention message, okay? Cover your cough. Cover your sneeze. Wash your hands. Can't tell you how many times or how easy it is for all of us to touch our face during the day. Don't touch your face. It's easier said than done. I get it. I'm doing it all the time, but I'm trying to get better. So everyday actions to stay healthy, as well as get a flu shot. We still have seasonal flu circulating within our community, and it's important for those who are able to receive the flu shot to get one. And then from a planning standpoint, citizens can develop a family emergency plan, and that's simple. That's the same message we give to citizens, whether it's inclement weather or whether it's a natural disaster or whether it's a regular flu season. So make sure you have adequate food and water supplies at home. Make sure you have an adequate supply of your medications, whether they're over-the-counter or prescription. In the event that this continues to escalate and we see additional orders issued from the governor and the Ohio Department of Health, if we ever get to the point that schools and child care centers may have recommendations and or orders, make sure you have alternate plans in place for children. And then obviously we should all be looking at travel that we have planned and making a determination, is it really essential, or should we cancel that travel if we don't really need to go, especially if it's to an area that's more affected than our area. Those are some common recommendations for citizens. But then also for workplaces and all of our jurisdictions within Montgomery County, there are recommendations as well. And these are the same things that public health is doing internally. So let's make sure that we're engaging all of our employees and our citizens and keeping them informed. We have to make sure at Public Health that in the event that this continues to increase and perhaps affects some of our workforce, and they're not able to work for several days or weeks, we have to make sure that we continue to offer mission-essential programs and services, and that we have redundant capacity in place regarding staffing. So all organizations, all businesses should be looking at their continuity of operations plans. Let's make sure we're reviewing all of our policies, especially our leave policies, as well as transitioning from in-person meetings, if not needed, to virtual or telephonic type meetings, teleconference type meetings. And then ultimately keep public health engaged. If there are questions in your community and or your workplace that you need answered, we're a credible source of information. We can get you that information. So there's a lot happening right now. We understand that there's tremendous frustration. There's so much information being rushed at us in such a short period of time that oftentimes it's difficult to digest and understand. Let public health be that point where we can inform you and interpret information that you need. So thank you in advance for your patience and understanding, because we are clearly moving to some disruptions or changes in our normal way of life. But those are necessary because it's ultimately about the greater good. It's not about individual health per se. It's about protecting population-level health, the population of all 500,000+ residents of Montgomery County. So let's make sure we all do our part. And I think it's equally important that as a community, we need to define ourselves. Let's be kind to others. Let's show compassion. We do not need stigma associated with this disease. Let's care for and help those who most need it. That's a powerful message. All of us should be adhering to it. I believe that by working together, we will continue to meet this unprecedented emerging infectious disease public health challenge in our community. So thank you for that. And with those comments, I will turn it over to Ron Nankervis from Winter Guard International regarding some decisions that have been made regarding that upcoming event.
Good afternoon. At the direction of Public Health, Dayton and Montgomery County, and in consultation with the Ohio Department of Health and Governor DeWine, WGI Sport of the Arts is canceling the 2020 WGI World Championships for Color Guard, Percussion, and Winds. Creating opportunities for young people is the foundation of WGI. Our World Championships are the culmination of a competitive season featuring 70 regional events. Participants and fans look forward to coming to Dayton each April, as we have done for over 3 decades. This will mark the first time in 43 years this tradition of excellence will be interrupted by an unprecedented situation. The numbers involved in an event of this magnitude urges caution in light of recent national and international health concerns. Over 9 days of competition, groups from 41 states and 5 countries with 16,000 participants consider Dayton a second home to showcase their talents on a world stage. Over 65,000 enthusiastic fans and supporters traveling to Montgomery and surrounding counties in Ohio and Kentucky bring significant financial impact to a city that welcomes WGI with open arms. We are deeply saddened to cancel these prestigious events. Our priority is, and always has been, the health and well-being of all those in our organization. We are grateful for the support and guidance of Dayton and Montgomery County Public Health, as well as Greene, Hamilton, and Campbell counties in arriving at a decision that is in the best interest of all parties. Over the coming weeks, WGI will work with our World Championship groups, vendors, and hotels as we work through the ramifications of this cancellation. We will be back in 2021 and will once again bring this unique, world-renowned event to Dayton. Though it's true the 2020 WGI World Championships will not take place as we hoped, WGI will continue its mission to provide a venue for young people to achieve the extraordinary through performance and competition.
Thank you.
So now we have some comments from Jacqueline Powell, President and CEO of Dayton Convention and Visitors Bureau.
Good afternoon. Our organization has been closely watching this situation unfold, and we have had numerous conversations with officials here at Public Health and with our partners, including hotels and event planners. These are unprecedented times for all of us. While it is sad and disappointing to see these events affected, we fully support our state and local officials who are making these very difficult decisions for the health and well-being of our local citizens and visitors to our community. In the coming days and weeks, we will be meeting with our hotels, venues, and event organizers to navigate through the cancellation process. We appreciate the support of our community partners. We look forward to a better health situation for our community, the state, the nation, and the world to ensure a positive future for the travel and tourism industry. Thank you.
It's really important that we speak with one voice as a community, and so we are very fortunate that within this county we have tremendous collaboration at the city level and the county level. And so it's my pleasure to ask Mayor Nan Whaley to make some comments today.
Thank you. Well, good afternoon, and as you can see, Commissioner Cooper was at the morning meeting, at Dayton City Commission meeting, with kind of a different message than we are having this afternoon with the governor's order coming down tomorrow. What we are encouraging is for everyone to pay attention and think about their own personal situation. And it is different if you are a younger person that has a strong immune system versus an older person that has a weakened immune system. You need to really make decisions on whether or not where you're going is really, really necessary. So I want to echo what the governor said at his 2 o'clock press conference about making these decisions ourselves. And you know, what we're trying to do here, why this is important for us at the city, is we want to make sure that the health system does not get overwhelmed in Dayton. So that is on all of us. Every single one of us can make the decision about whether or not we go places to make sure that we stay healthy and we do not contract viruses from other folks as well, right? So in the next day, you'll see the order coming from the governor. I know lots of organizations will be waiting for that order to formally close their events. Then you will also see from us at the City of Dayton an announcement of what public events, I think most, if not all, of our public events will be closed, from neighborhood meetings to other boards, etc. We'll be announcing those as well, encouraging our citizens to stay home and avoid public contact. Now, Dayton still has to provide first responder services. We'll continue, of course, with police, fire, trash, etc. The day-to-day services will continue on, but we will be in the focus of making sure that we're modeling good behavior as well. This is incredibly hard, I think, for elected officials across the county and across the city. We live on going to public events and encourage everyone to come out. This is an opposite action that we normally ask for. So we're asking folks to really pay attention, to listen to what Jeff said. The health commissioner will be key in this. Check out Dayton Montgomery County Public Health site regularly. The City of Dayton will link to that. We'll continue to link to that. And then still, make sure you're taking good care of yourselves. Make sure you're washing your hands often. Make sure you're coughing in the right way. Make sure you've gotten your flu shot. Those are the things that we can do to help. But we're really in the focus of social distancing. The epidemiologists know that it is likely that this moves very quickly, that we know that this is probably among us right now. So that's why the social distancing is happening right now. And you can see just in 48 hours from the governor putting the declaration of emergency to having a case in Canton where it had not traveled, had not been in touch with anyone. We're in community contact phase in the state. That's very serious. We're taking this very seriously, and we need everybody in the community and the media to take it seriously as well. We're not panicking. We're just being really thoughtful about public events and social distancing. We'll be in a different phase over the next couple months because of this, but because we do it right, and I'm proud, I know Dayton will do this well, we'll be able to save lives and keep our health system intact. That's what we're trying to do here. Thank you.
Thank you. We're also very fortunate today to have Commissioner Judy Dodge, who will be making some comments on behalf of the Board of County Commissioners.
Thank you. Thank you. I'm Commissioner Judy Dodge, and my fellow commissioners are here, Carolyn Rice and Debbie Lieberman over here. You know, Montgomery County and Public Health are working together to ensure that our community is well prepared to respond to the new coronavirus. We have robust emergency plans in place to ensure the safety and well-being of the public. Our emergency operations is currently on standby, and we are monitoring state emergency operations as well as supporting public health efforts. Montgomery County is currently reviewing contingency plans to ensure the safety of all of our employees, as well as the continuation of essential operations. We are working together with Public Health, the Greater Dayton Area Hospital Association, the Sheriff's Office, local law enforcement, and fire departments. They are all doing an excellent job and are well prepared to handle this situation. We want to reassure the public and ask that you remain calm. Much like the spread of flu, the best thing you can do to help our community is to practice good hygiene that will prevent the spread of germs. I know many of our businesses and community partners are also taking steps to limit large events, as well as gatherings to minimize the potential for community transmission, and we appreciate their efforts as well. Thank you. Jeff.
And with that, we would be happy to answer any questions that you may have.
Are you currently testing anyone in Montgomery County for coronavirus? Are there any cases you're monitoring?
We have one person under investigation within Montgomery County.
Can you say where that person is?
No.
Mayor, can you comment right now if there's a change in status on the first floor, if there will be spectators barred from that event?
Well, I can only see what you all saw at the 2 o'clock press conference. We're waiting on the governor's order. I know that Public Health and everyone has been in touch with the NCAA, but it's an NCAA decision on what they do with that, with the moving forward. So we'll be, I'm sure, hearing in the next few days.
What sort of a financial impact are you thinking this is going to have on the community?
Yeah, it's going to be tough. I mean, we're talking about a couple months here, and we're encouraging people not to go out, which again is the exact opposite of what we typically encourage people to do for the economy. So I think we need to recognize that people, we're starting to think as well as we get the emergency table up and going, how do we make sure that people have access to food, how they make sure they have access to the doctor. There's all those kind of things that need to be considered as we continue to move forward, because we're asking people to change their behavior and the way they're acting today. And I think that's what is really important to understand, is that we're into a situation with the coronavirus where it's not just keep on doing the same thing. We're asking people to act differently, and that will have an effect on the economy.
Is this the biggest threat to public health that Dayton and Montgomery County has ever seen?
Well, I'm younger than Jeff Cooper, so I'll let him answer.
Well, you know, I used to think I was young until now this new definition of older adult for coronavirus. So from an emerging infectious disease standpoint, in terms of the scope and magnitude, obviously we responded as a community, a state, and a country in 2009 with the H1N1 influenza pandemic. Obviously a different virus, an influenza virus versus a coronavirus. But I think the difference is the sense of the urgency and the level of emergency because of this immediate communication and social media and so forth. So there will always be pandemics that occur, and it's difficult to say something is more important than something else. We should never lose sight of the toll that the opioid crisis has taken on our community, or the long-term years of potential life lost with infants dying. So it's hard to say. This certainly, from an emerging infectious disease standpoint, is clearly unprecedented in recent times.
Commissioner, you talked about having an adequate supply of food and water at home. Why is that important? Is that because of possibly needing to quarantine, or?
I think it's just best practice from a national standpoint regarding emergency preparedness. We can never predict what may happen, including availability of supplies in various locations and stores. So it's common sense, best practice to maintain a supply of necessary items in our homes.
But let me just say too, we're not saying go buy a month of toilet paper, okay? Like, we're talking, we really think of the 72 on you, 3 days, make sure that you have everything you need for 3 days in your supply, okay? So I don't want folks to say, like, let's go buy out Meijer and Kroger today, all right?
Does the area have enough test kits in the hospital systems?
Talk about test kits.
Oh, doctor, please talk about this.
So
We can say that the Ohio Department of Health has a certain number of testing kits from the CDC. Those kits are more or less being reserved for the most severe cases that are coming to attention. But at this point, any physician can order a test for this virus. There are 2 clinical laboratories that are offering the test. My wife was talking to me this morning. Their office is set up to be able to do this, so that they've got the materials. It seems like it was pretty easy. So I expect that for anybody that a physician feels this is a suspect disease, that they can get this test the same way they could test for flu or something else. The results take a couple days to come back, and in fact, for someone that doesn't require hospitalization, the instructions to that patient would be very much the same as if they had a flu. I mean, if you're coughing and you feel terrible and you got a fever, go home and stay there. For the people around them, keep your distance. You want to do that with somebody with the flu as well. You want to wash your hands, want to do all the regular things. It seems like this virus transmits a couple of times more easily than the flu virus, which I think just means it's something that we've got to be aware of, and we've got to make sure that we do the things we know that protect us. Keep track of, I'm not touching my face. Keep track of, I'm washing my hands and I'm doing it with hot water. And just kind of do the things that we know, but be more intentional about it, because this is something that we want to control as fast as possible.
So we also have Sarah Hackenbrack, President and CEO of the Greater Dayton Area Hospital Association, to offer some comments.
Thank you, Jeff. So I work with 29 hospitals and health systems in the 11 counties surrounding Dayton and Montgomery County. And our hospitals, as of Tuesday, activated their board-level task force, including hospital leadership, our presidents and CEOs of the region's hospitals, as well as designated clinical leaders, to work with us on coordination for infection control, human resources, public affairs and messaging, in partnership with Dayton and Montgomery Public Health, and our sourcing and emergency preparedness activities. Those are things that we meet and coordinate services on a regular basis, and so very much like public health, these are activities that we practice and prepare for on a monthly, quarterly, and yearly basis. And from a testing perspective, again, we are limited with what has come into the state of Ohio, but we are looking at additional testing procedures that can help us rule out other types of communicable diseases, such as influenza A, and making sure that we are pinpointing the right type of communicable infection that is coming into our member organizations and physicians' offices in our region.
So one of the questions was the person prior to Sarah talking. That was Michael Doane, MD, Public Health Medical Director.
Are we good?
The hospitals associations, are you limiting the number of masks that healthcare providers can take?
We are not limiting the number of masks that healthcare providers can take. We are monitoring the supply of all personal protective equipment that applies to this particular situation, very much the same as what was done during the H1N1 influenza outbreak. And so we're monitoring those supplies at the regional level, and we're reporting our supply quantities into the Ohio Department of Health, and that is happening across the entire state of Ohio.
Within the hospital networks that are in the Miami Valley, are there any healthcare workers that are currently being tested or monitored for coronavirus?
Not to my knowledge.
Okay. We good, Chuck?
Yeah, I think we're good.
Thank you. Thank you. Thanks for
All
your
right,
time.
thanks everyone.
Okay, thank you. Yeah, no, it's perfect.